My name is Noriko Nakamura, and I am a PhD candidate at the University of Kansas. Today I am presenting my project, a systematic review of music interventions targeting memory in adults with acquired brain injury. I decided to carry out this project because I have worked with many people who had acquired brain injury, ABI, and memory was one of the areas affected by ABI. And there are systematic reviews of music interventions for people with ABI. However, there was no review specifically focusing on the effects of music interventions on memory of people with ABI. The biggest challenge I had during this project was that some articles didn't have the information I needed for the article screenings. Therefore, I had to contact some study authors. So, what is a systematic review? A systematic review synthesizes findings from related research. And in this project, music interventions are defined as the therapeutic uses of music, such as songs, chants, and/or musical elements, to address treatment goals. And memory involves information acquisition, retention, and retrieval. And ABI includes all post-birth brain injuries. The purpose of this study was to analyze and synthesize information in studies using music interventions targeting memory in adults with ABI. And the research questions were, what are the study characteristics? What are the targeted memory outcomes described in the study results? And what information is provided about interventions? And we used both database and hand searches. And for methodological quality assessment, we used the mixed methods appraisal tool. And after screenings, 18 articles were eligible for this review, and the most common study design type was randomized controlled trials. And findings showed that the methodological quality of the 18 articles were diverse, and the qualitative and most of the randomized control trials had a higher quality than other studies. And we also identified the areas for improvement, and those were transparent reporting, comparable groups at baseline, inclusion of complete outcome data, and blind outcome assessment, and strategies to increase intervention adherence, and confounders being addressed in study design and analysis, and qualitative and quantitative components in mixed methods studies meeting methodological quality criteria for each component. And moving on to data extraction, the most common authors were medical doctors, followed by music therapists and psychology graduate students. And the most common study location was Finland. And participants' age ranged from 18 to 80 plus. And 12 of the 18 articles focused on adults with stroke. The most common memory type addressed was verbal memory. The most common measure was digit span, and overall outcomes of the reviewed articles showed positive. And music intervention characteristics. The person selecting the music. The most common answer was participant. And 10 of the 18 articles used published music. And in terms of music delivery method, 9 of the 18 articles used recorded music. And I also would like to mention that music listening was the most common intervention, followed by instrumental play and musical mnemonics. And in terms of dosages of music interventions, the most common number of sessions was 60 times. The most common session duration was 1 hour. The most common session frequency was 7 times per week. So that was from music listening studies. And unit of delivery, more studies used individual sessions than group sessions. And data analysis and synthesis uncovered that the frequency and duration of participant-administered music listening was consistent across the reviewed articles. But in contrast, the frequency and duration of live music interventions were not consistent. However, this is understandable, and this does make sense because there are many different types of live music interventions. In terms of clinical and research implications, the information about the dosages of music interventions, such as frequency and duration, should be helpful for clinicians. And research implications. The areas for improvement identified in the methodological quality assessment should be helpful for researchers to design high-quality studies. And the continuation of music intervention research on memory of adults with ABI is recommended so that we can continue to benefit these individuals.